The American health care bill, presented by House Republicans as the repeal and replacement of Obamacare, is in a holding pattern at the time of this taping. We tape 12:15 every Friday, so we think the vote is scheduled to happen later this afternoon. Assuming it does go for a vote in the House today, as expected, we know Representative Mike Coffman has said he is a yes vote, and at time of this taping, Ken Buck was still unsure which way he would go. Eric, again, by the time this is broadcast at 8 o'clock, we're going to know that the vote didn't happen because they're just going to save their, as you say, save their power, fight another day, or they went for the vote and it failed. Do you think the votes that Mike Coffman we know is going to vote yes, is he or Ken Buck's vote going to matter as they face re-election in 2 years?
Ken Buck's vote doesn't matter because he's sitting on a safe seat. I'm increasingly thinking Mike Coffman sits on a safe seat. I think how these votes matter is not in their terms of their individual congressional seats, but just in terms of the tenor of the whole year. Are the Republicans competitive in 2018, or is it such a shambles in Washington that you have another change election after a series of change elections, which is, you know, throw one set of bums out and now throw the next set of bums out. I ascribe to Senator Tom Cotton, conservative Republican from Arkansas, just elected to the Senate, former congressperson. He issued a couple weeks ago a warning to all his former colleagues among House Republicans saying, you're going to stick your neck out here, you're going to jeopardize your political career voting for a bill that has no chance of getting through the Senate. So part of me wonders why Republicans are walking this plank. Whatever happens or doesn't happen this afternoon between the taping and the airing of this show is not the final word. It's only an early word. That is not what this legislation is going to look like. Lastly, I would just say, Dominic, I'm increasingly attracted to the point of view that we're asking the wrong questions about health insurance. We ought to be treating health insurance as opposed to full health coverage. We all have car insurance. You don't expect your car insurance to pay for when you fill up the gas tank or change the wipers, need a new set of tires. But yet we are increasingly into that mode with that health insurance has to cover everybody for everything. That is unsustainable in this country. We're seeing what it's doing to our deficits. Neither party is willing to face that task.
I think it's an extremely good point there, Eric, but the only problem there is that people can choose not to drive. So, but I get your point. Susan, we're running out of time, but as you look at from what we know so far, again, we don't know how it's going to roll, what do you think is going to move forward from this issue?
I predict that we're all going to be waiting through the weekend, despite Trump's call for expediency here. I think it's fascinating what's happening to Coffman. I understand why people think that's not such a competitive district, because he beat two very tough opponents, but that was still a district that went 9% for Clinton, and it's a district that has said to him loud and clear, we don't want repeal here. It's a district that has big hospitals. It's a district that has rural hospitals. And so almost in some ways, like Eric said, I just don't see how this is a winning proposition for him.
Patty, we're running out of time. Your thoughts?
Well, it looks like a winning proposition for no one right now, especially Paul Ryan. If Trump insists it goes to a vote, he loses. I would hope they just all put the brakes on and revisit this bill, because it is a loser for everyone.
Amy, wrap it up for us.
I think Ken Buck is going to look at what happened with Congresswoman Betsy Markey, who, by the way, was vote number 216, got it passed. The Obamacare is wildly unpopular in CD4. I suspect this bill is also wildly unpopular in CD4.